Hi, I'm Maureen Testoni, the President and CEO of 340B Health. I'm here with a message about this week's anniversary of the creation of the 340B program. But first, I recognize that we are in extremely challenging times for everyone involved in healthcare. The work many of you have done to confront the global pandemic is heroic, and I thank you for being on the front lines. 340B and the savings it creates are critical elements of this response. Now, more than at any time in its history, 340B is needed to help us care for patients in need. We've heard directly from you how 340B savings are helping provide care to patients with COVID-19 and those with chronic conditions, as well as to continue to provide critical services to patients despite plummeting health hospital finances. Many of you report that 340B has helped you launch or expand your telehealth services. And I was pleased to see that HRSA extended flexibility to allow for 340B drugs to be provided in new locations where they were needed. And we have heard from many rural hospitals that 340B is what keeps them open. Thanks to new research, we now know that 340B hospitals provide 75% of hospital care for Americans on Medicaid and 60% of uncompensated and unreimbursed care. That is the true definition of a safety net. We also know 340B discounts discourage manufacturers from raising their prices quickly, proving again that we are fulfilling the goals of this program. Yet, amid the public health emergency, 340B hospitals continue to face efforts to reduce the size and scope of the program. As you know, the manufacturers Eli Lilly, AstraZeneca, Sanofi, and Novartis have sidestepped federal law by refusing to provide 340B discounts on their drugs when used in community pharmacies. Another company is demanding outrageous amounts of patient data from hospitals, clinics, and health centers. These challenges have brought the 340B community together in ways I've never seen before. More than 1,100 hospitals signed a letter to Health and Human Services Secretary Alex Azar demanding he stop these actions before they cause irreparable harm. More than half of Congress also urged him to act. And last week, more than 60 organizations representing patients, consumers, and advocates for social justice sent him their plea for action. The fight is far from over. And we will use every available method to halt these unlawful behaviors. On the 340B anniversary, the best gift you can give to the program is to continue advocating to policymakers and your communities on how 340B helps safety net providers and the patients who rely on them. Together, we can ensure 340B is healthy for years to come. Thank you.